COVID-19 infections continue to surge in Alberta. The province recorded more than 1,000 new cases Wednesday, the highest since mid-May. And as usual, it's unvaccinated Albertans that make up the majority of the COVID cases in the province. Dr. Michelle Bailey is a pediatrician. She's also the president of the pediatrics section of the Alberta Medical Association, and she joins me in Calgary. So, Dr. Bailey, when you heard the number yesterday, first, just take me inside your mind. What went through it?
Yeah, thanks, Kathleen. It's a very disappointing. I can't say was surprised to see that our numbers were rising and that we met over the 1,000 mark. But I think it is indicative that the wave that we are been talking about over the last several weeks and talking to the government and others about is seeming to move forward in the way that we had unfortunately been thinking that it was going to move for us here in Alberta.
So you were shocked but not surprised, it sounds like what you're saying, and you could see it coming, and I assume it's because of the lack of COVID measures. So many of them were lifted on July 1st. So talk specifically about where you see the gaps.
Yeah, I think we are aware that the wave 4 of COVID was going to happen. We have a very contagious current variant, and we've watched this unfold in other countries before us. So those are factors that we know are in place. When we look at differences perhaps between provinces or different areas of the country or of the world, I think some of the measures that contribute to surges becoming a bit more aggressive, as we're seeing in Alberta, are things like the restrictions or lack thereof and vaccination rates in our population. And in Alberta, while we have seen some improvement in our vaccination rates, we are still under many of our provinces across Canada, and so we have less protection in our communities. While you can still get COVID when you're vaccinated, we do know that it does reduce, doesn't completely eliminate, but it does reduce your ability to spread the virus, and obviously really protects you from hospitalization, because while COVID numbers are one thing, hospitalizations and ICU stays are the very concerning measure that we are really interested in. Also in Alberta, we have not had masking indoors as a rule across our province now for several weeks, and we have had some cooler temperatures as well over the last little while, so people are doing more indoor activities, and that is causing more spread for us in our population, and more hospitalizations, and particularly.
And of course, as you point out, masking is not something you see much of in Alberta any longer. Manitoba, BC, reintroducing broad mask mandates as a way to curb the severity of the fourth wave, but the Alberta Premier and Health Minister both saying the mask mandate is not coming back. So how disappointed are you in that?
Yeah, it's very disappointing. I think that we are always balancing the pros and cons of various measures, but we are going into a robust fourth wave. We have a considerable unvaccinated population, and as a pediatrician, obviously the population that concerns us greatly is the under 12 population, and particularly our higher risk children and those under 1 year. So we have that group, and we know that masks actually do reduce transmission in places where we can't socially distance. They work well. They're something that everyone has become familiar with. And so it's disappointing to see that we're not seeing the leadership of mandating that in our public spaces to protect those who are still vulnerable.
What's your view on vaccine passports? Would they help?
Yeah, I think that what we're seeing in terms of our some companies and universities, for example, as well as some government organizations in many places, are that concept of requiring vaccination. And what vaccine passports can do is to incentivize incentivize people to get vaccinated if they're waiting for a reason beyond the many that we have out there. Vaccination requirements for travel or for occupation or for attending certain events can certainly incentivize people to be vaccinated, and we know that's one of the most important measures for us from a public health standpoint. It can also be reassuring for those who are attending social events or a workplace, for example, to know that they are not inadvertently passing on a infection to an unvaccinated person if they themselves are vaccinated. While they're less likely to spread the virus, we know that asymptomatic people can still have and spread the virus, and people feel responsible for that risk. If we are in concert with other vaccinated individuals, we're less likely to be resulting in that person being hospitalized, for example.
Finally, Dr. Bailey, you're a pediatrician. Kids are going back to school. What do you say to parents who are anxious about their kids going back to school while this surge is going on?
Yeah, absolutely. And we were pleased to see that many school boards have put measures in place for their school systems to ensure that masking is occurring in indoor spaces while allowing children to be in school and participating in the many activities that are so important for them. So kudos to those school boards that are making those decisions to keep things safe as we go into the fourth wave and continuing their precautions around some aspects of cohorting and obviously sanitation and ventilation. So those are really important measures. I think for parents, they need to know what's happening in their local environment and particularly in their local school, and obviously assessing the risk in their family and in their child. Thankfully, children still who who unfortunately get COVID, the vast majority of them continue to have mild illness. As we see larger and larger numbers being infected, however, we are going to see cases rise in our hospitals. So for those families whose child is become unwell, we would like to encourage families to continue to stay home when their child's sick, even with a mild cold, whether it's COVID or not. If their child does unfortunately get COVID, it's monitored carefully for those symptoms that are more worrisome, shortness of breath, difficulty breathing.
Thank you. We do have to leave it there, but I really appreciate this, Dr. Bailey. Thank you.
Thank you very much. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.